Hey, Dr. Ferguson here. I just wanted to give everybody an update on the new Motiva implants because people have been asking a lot about them. It is the newest implant on the market here in the United States. First real new implant we've had in a very long time. So it's kind of exciting to have something a little bit different. There's a few things that are different about this implant that I wanted to point out. I've got a couple of them here. They have two different types, and we'll kind of talk about that just a little bit. But one of the things that's very different about it is the surface texture. So it is considered a smooth implant by the FDA. They call it a silk surface. It's just the smallest amount of microtexturing to inhibit capsular formation as well as inhibit bacterial growth. So that is something that is very different and new with these implants. The other thing that is a little bit different about these is they are molded as one piece. So it's not just a shell that's filled with silicone, it's actually a silicone gel that is molded in one piece. They also have a leak detection system, so if it's got any sort of defect coming out of the box, we can tell because it changes color if there's any evidence of a leak in the shell. So all those things are kind of new and neat. They have two different types. There's the round form, which is the firmer gel. These are both highly cohesive gels, as most people have become familiar, and oftentimes people just refer those gummy bear implants. Same sort of thing. So there's the round implant, which is more of the firm implant, and then they have their ergonomic implant, which is a little bit softer. I'm sorry, there's not a great way to show you that in a video, but if you hold them upright, you can see that the round implant holds its shape a little bit better than the ergonomic. So the idea being, if you want to maintain that upper pole more fully, then the round implant is going to give you a little bit more of that support, and the ergonomic is going to give you more of a natural appearance to the breast. We kind of tailor that to the patient's desires and figure out what it is they're looking for and find ways to make it work for them either way. The other thing that I kind of like about these that's a little bit different is the capsular contracture rates for these have not been shown to be any different placed above the muscle as compared to below the muscle. And that's a bit of a paradigm shift for those of us that trained back in the era when the silicone implants were not allowed by the FDA. Saline implants were found to have a much higher capsular contracture rate if you put them above the muscle, so all of us trained putting them below the muscle. So that is a different deal, and it makes it so that in some patients we don't actually have to divide the pectoralis muscle and put it below there. It also eliminates that what we call an animation deformity when somebody flexes and their implants bounce up and down. That's troublesome to some people, and putting it above the muscle does eliminate that. So if we're able to do that without increasing the rate of capsular contracture, that's a nice option for some folks. The other thing is that their shape is determining what you're going to see, and so it makes it a little easier sometimes to put it above the muscle in some of these softer implants without giving it too artificial a look. So if you want to talk some more about these, I'd love to go over them with you in the clinic. Kind of exciting to have something different on the market that we can talk about, and we've put a fair number of them in already and have been very pleased with the results. So if you want to get together and visit some more about it and you have more specific questions, I'd be happy to get them taken care of for you. All right, hope you have a great day.